Welcome. Thank you for joining us this morning for Operationalizing Equity, Early Childhood Education and Early Care Action and Family Councils. My name is Cicely Fleming, and I am the State Director of Birth to 5 Illinois, a new public-private partnership that was formed last year in response to a call to address inequities in Illinois' early childhood and early care system. This session will discuss the major early childhood structural changes occurring in Illinois to meet the governor's desire to make our state the best state to raise young learners. Recognizing systematic inequities are exacerbated by our fragmented infrastructure and policies, this session will discuss the work being done to explore a unified ECEC system in one state agency, a new equity-based funding model, and the current efforts to launch regional and community infrastructure to inform decision-making and operationalize equity throughout our state. In our discussion today, you will hear from Theresa Hawley, Director of Early Childhood Transformation Team, Sonja Clark, the Director of Operations for Birth to 5 Illinois, Jodi Scott, Superintendent for Regional Office of Education number 33, and Trish Rooney, Fox Valley United Way Vice President of Programs. Each speaker will highlight the work that they're doing in our early childhood and early care system and the importance of this new state infrastructure. I now turn it over to Theresa Hawley.
Good morning, everyone. So we're excited that you came to learn more about what we're doing in the Birth to 5 Illinois initiative. We are, as Cicely said, this grew out of the work of the Governor's Commission on Equitable Early Childhood Education and Care Funding, or the Funding Commission, that was convened in December of 2019 by the governor with the charge of taking a really deep look at our early childhood system and understanding where we needed to make some changes to make the system work better for children and families and providers all across the state. The commission issued its report in March of 2021 with the charge to the state government to make our system simpler, better, and fairer. And that encompassed a lot of different things, focusing on the way that we're trying to get our early childhood resources out the door, the way that we're allocating those resources across the state and across different kinds of programs, but really centering it all on creating a more equitable system with intentional focus on supporting racial equity in the way that we're planning, funding, and operationalizing our early childhood system all across the state. As we thought about that, we really thinking about how do you operationalize equity? What is it that we're really trying to do here? And really, it's two parts to this. There's equity in the inputs and equity in the outcomes. What we're really striving for here is a system on the inputs, equity and inputs, that's driven by parent and community and provider voice in how we develop our policies, how we design our allocation systems of resources, how we build up a system. So it really is answering and meeting the needs of all the diverse children and families that exist across all of our communities in the state. But it's also really about equity in the outcomes. We need to be developing services and systems that help support families so that their children really are ready to succeed as they enter kindergarten, eliminating those gaps in kindergarten readiness. So now it's not enough to say that we are serving everybody or that we're giving everybody some kind of equal services across the state. It really is about tailoring those services to the needs that really are out there all across the state and making sure that they're designed to in response to families and communities' voices. The challenge, of course, with all of that is that there isn't an infrastructure already existing in the state where we can gather all that voice all across the state in a really clear way that is able to feed that up into our early childhood policy making systems. We've had the Early Learning Council for a long time, but it doesn't have the reach and the depth and the presence in every community across the state to be gathering that voice and bringing it together in the service of creating better early childhood policy. In contrast to the K-12 system, where we have school districts all across the state who are responsible for doing early child or for doing K-12 schooling, or community college districts that are responsible for meeting the needs of the folks within their district boundaries for higher education services. We don't have anything like that for early childhood. And so we knew if we wanted to build a more equitable system that really was addressing the needs of communities all across the state, we needed to create an infrastructure that could allow that. So, and one that covered the whole state. So the first thing that we did coming out of the funding commission is the governor approved the creation of Birth to 5 Illinois, which is a regional and community infrastructure for our whole state to be able to gather that community voice, be that equity in the input so that we can start moving towards equity in the outcomes of our early childhood system. And I'm going to turn it over at this point to Cicely Fleming to talk more about the Birth to 5 Illinois system.
I am muted. Of course, someone had to do it, so I broke the ice there. Thank you, Theresa. So as I said in my introduction, I'm Cicely Fleming. I am the State Director of Birth to 5 Illinois. And so Birth to 5 really is all of what Theresa encompassed. We're trying to make a statewide infrastructure that's going to support all of our learners across the state and their families. So what we're doing in this infrastructure is something that's a little bit different. Instead of having elected offices, as Theresa mentioned, with our school districts, we are looking to bring in community voice, and that community voice needs to represent a variety of perspectives. So not only those who are already working in our early childhood centers and parents and other advocates, but we're looking to bring in elected officials and caregivers and business owners and a variety of people who we think are going to bring important knowledge and perspective to this community council. The way we think of these councils working is really as being a localized advocacy body for expanding early learning throughout their region. We are following the Regional Office of Education mapping that is designated by ISB. And so there are 39 of those structures around the state. And so each region will have its own family council as well as an action council. And they're going to be proactive in looking at data, but not only data, making sure they hear from those people who are experiencing our system now. And so those providers, those caregivers, those family members, those teachers, to make sure everything that they learn and everything that they do really does center the voice of people who are experiencing our system, who have the firsthand knowledge to tell us what is broken, what's working, and what expansion they need. So this new model is going to prioritize that engagement and build upon existing work that's happening in the community that Trish will tell you about later with some of the local collaborations. While they're doing the important work of trying to connect parents and families to the services they need, we know that that's not enough, and we still have a lot of parents and students who are left out. Despite efforts that are happening in community and more funding that we are thankful that's going into our system, we know that we're still creating a system that has inequitable outcomes, as Theresa mentioned. If we look at those students in minoritized populations, that includes race, our English language learners, special needs, children from families who have limited financial incomes, we know that those students we continue to put in a system that doesn't meet the needs that they have, and therefore they're entering kindergarten unprepared. As Theresa said, the commission pointed out racial equity, as we all know, being a huge barrier here in our country, right? Race is able to predict your socioeconomic status, your life expectancy, your educational attainment, your involvement with the criminal justice system, and so many other things. So we have to really be intentional in our work and throughout the state to center race. And we know that we've heard from communities that say, well, you know, the race inequity is not an issue in our community. Unfortunately, we do have communities where we still have very homogeneous communities. However, if you study racial equity, you know that by focusing on racial equity, that lifts everyone. And so no matter if it's not a barrier by race or predicted by race, we know that children aren't entering kindergarten at the same level as their peers. And so by focusing on racial equity, we're able to lift everyone and meet the needs that they have. And this group is going to help us really understand and identify those needs, not only for our policymakers in Springfield and throughout the state, but as well as our local community. By bringing in elected officials, they will learn more about early learning and the experiences that parents are having, and think about their own municipal budgets and how they can use them. That's county budgets, as well as like city or township budgets. And so we're hoping that this model really provides a space for everyone to do a lot of learning together, and for us really to have these bodies that are advocating their state, but as well as advocating their community, the importance for equal access to quality high care learning. We also want to respect parent voice. So we have this family council that Sonja is going to tell you about. The family council is a way for us to make sure the family voice is centered. They are the ones who are experiencing our any deficits we have or barriers, and they are the ones who can help us fix them. We have to make sure we're centering what they want and what they need before we make any decisions throughout our state, because our state can look at the data we have available, but we don't understand that unless we really center the voice of parents. And so that's what we're looking to do with our family and parent council. The design models there at the bottom, we try to make sure everyone's voice is important. We have our kind of circle model there versus some kind of hierarchy, because we all come to this experience with different understanding of early learning, different motivations for becoming involved. But we all know if we put our voices together and we all kind of look at this from what's best for our students, that we can really change our system throughout the state. And so these councils are starting to launch as soon as communities are ready throughout the state. We started with some aggressive kickoff sessions via Zoom that we held last month, and starting next week, we'll be doing some community meetings. So these will be live webinars where our state team will go into each community, given this pandemic online, to hear more about what people's concerns are with early learning, to explain more about what we're doing, because we understand this is a new concept, and we want to make sure we're available and responsive to the community needs. We are looking to provide staffing, because a lot of the work that folks like Trish and other local collabs are doing is being done in addition to other jobs. And so that also creates barriers and inequities. And so we're looking to produce, to support these councils with staffing that the state will fund, so that parents can really be involved and teachers can do their jobs as well as participate and not have to run additional meetings. We're looking to bring in faith communities and business leaders and really whoever is interested in joining us, to make sure that everyone in the community really can understand and advocate for early learning expansion. So I think next we're going to go over to Sonja Clark, who's going to be able to tell you more about the most important piece of this, which is family voice. I just wanted to remind everyone we do have a chat function for questions, which we will be taking at the end of our presentation to make sure we can address anything that wasn't clear for you. Sonja, you are up next.
Thank you, Cicely, and good morning, everyone. As Cicely said, my name is Sonja Clark. I'm the Director of Operations at Birth to Five, Illinois. And so Cicely talked about the action councils and a little bit about the family councils. So I'll go into a little bit more detail about the family councils and how we're centering family voice in this process. So like she said, in addition to the action councils, we are looking to stand up a family council in each one of those 39 regions to make sure that families, especially those from those priority and minoritized populations, are engaged in helping to reshape the system. So in addition to the family council, there is representation that will be on that action council. There are 2 seats that are reserved on the action council as well for family representation. And then we're looking to have a council that's all existing just of families together. We're looking to engage families that have children under the age of 8 with varying experiences and have had different touch points with Illinois' early childhood education and care services, and encouraging them to apply to join one of their region's councils, either the Action Council or the Family Council, whichever one they feel most comfortable and feel like their impact would be most felt. So they are open to join either one of those councils. And we anticipate the membership of the Family Council to be around 15. Some regions may have more members, some regions may have fewer members, and we also understand that there may not be an interest right away for family councils, but where there's interest, we will stand those councils up, looking for a membership of about 15 members on those. Like Cicely said, and Theresa said as well, we're aiming for various levels of diversity and representation from families, which will include just a wide range of voices and perspectives from families that live across the region, specifically targeting those areas that have been under-resourced, and want to make sure that racial diversity representation is where it mimics the diversity of the region. So where there's representation and those diversity and those minoritized populations, making sure that that's representation represented on the councils as well. As far as commitment for membership on the Family Council, we are looking for a 1 to 2 year commitment, understanding that families have competing obligations and priorities. And so families that can commit to 1 year is wonderful. Those that can commit to 2 is even better, but they will have the option, even for those that initially maybe can only commit to the 1 year, they will have an option to be able to continue for a second year, just depending upon where their family is and how they're able to best be able to contribute to the councils. And so the frequency with the councils and how often they're going to meet and the timeframes of that is really being left up to each council. So each council will make that decision, but with an expectation that they are meeting at least monthly. But as far as the time, so if it's a 1 hour meeting, if it's a 2 hour meeting, if they decide they need to have 2 meetings a month, that will be left up to the council members themselves, kind of looking at everyone's availability and what they're able to contribute as far as time is concerned. So that will be left to each individual council to make those determinations if it's going to be more than once a month and the time frames that will come along with that. The family councils as well, we are providing stipends. So we want to make sure that we are valuing the time of families and their expertise that they are contributing to this process. So we are offering stipends, albeit not extensive stipends, but we are offering stipends to families. And those are families that sit either on the family council or the ones that are sitting on the action council will be given stipends for their time and their expertise. As far as the structure of support at the state level, we have our family and community engagement manager, who is Dina Chapman, and then we also have our family and community engagement coordinator, who is David Quiros, that are providing that guidance and that support at the state level around strategies, priorities, trainings, and things like that for the folks at the regional level. And so at the regional level, we'll have a regional manager and also a regional family and community engagement coordinator who will really serve as the boots on the ground in every part of the region, intentionally seeking out those families that have, historically been left out and not had good opportunities to be involved in decision making. And so, like I stated earlier, we will, in lieu of a family council, as we understand, there are some areas in the region where there may not be interest right away. So in lieu of a family council, it'll really be the charge of that manager and particularly that family and community engagement coordinator to make sure that they're out in the community, garnering that interest and encouraging folks to stand up a council in those communities and making sure that we are getting that authentic family voice incorporated into this process. Okay, so centering family voice is really primary to our work and is a vital component of our mission, our vision, our values. And so, well, what do we mean when we talk about authentic family engagement? So when we think about authentic family engagement, it means that we are bringing families in from the very beginning and getting their input before, not after recommendations are made, agendas have been created, and policies have been made on their behalf. So family voice has to be present and informing at every step of the way, not as an afterthought after decisions have been made. It is really taking the system and flipping it from that top-down approach to the bottom-up approach, with those that are most impacted by those decisions and those policies being in the driver's seat of decision-making and policy-making instead of in the passenger seat, oftentimes in the back seat, or most of the time, not even in the car when those decisions are being made. And so we want to start building those trusting relationships by acknowledging the history of what has been loosely called, family engagement or parent engagement or family involvement, and what that has typically looked like versus the intentionality of what we're trying to do now. So it's not simply just having a seat at the table or checking that box or saying I have a certain number of families that I've involved in certain things, but really regarding them as respected partners and actually setting the agenda moving forward. And so that's what we're talking about when we talk about that authentic, family engagement, and just the acknowledgement of what has happened in the past. So there may have been a survey that was done to collect family perspective, and families never knew what happened with those results, or if those results were incorporated into anything, or if their feedback was somehow used in some kind of way. So we have to make sure that we're closing the loop when we get their feedback, and make sure that we are letting them know and making sure that they're in that driver's seat. We want to continue to build that trust with families in the regions by leveraging existing relationships that have been established locally, either through their direct service providers, so those providers that they have contact with, through those local collaborations that Trish is going to talk about a little bit later, and just every point that they've had contact with, just kind of leveraging those existing systems and relationships and building on those to reach families and get them interested and get their voice into this process. So messaging is going to be really important in that. And messaging really needs to be centered on why parent voice is important and what it means for parents to leverage their power, and to also just let them know that, the shift in priority, where parents are that priority that I spoke about earlier, where they're actually in the driver's seat and really driving the decision making, and their input is the impact and what we're looking for to do systems change work. So meeting parents where they are in the communities, boots on the ground outreach, and being flexible in communication and providing space to give feedback. So this is all of the things that these councils are going to accomplish, and we're going to give that space, being flexible, meeting times as far as, what's available and what's priority for families, and making sure that we're being considerate of meeting times and the time constraints that we know that this work is going to put on folks, and just being cognizant of that and being flexible around that, understanding that there's different levels of access to technology and social media and literacy levels and trust factor. And so making sure that we're building on those shared experiences, that we're talking about shared experiences, with folks that, that they feel look like them, or that have similar experiences, that they have experiences, and building that level of trust based on that as well. Also utilizing the parents. So as we get families involved in this process, utilizing them to help with outreach and getting other parents to join and garnering their feedback as well, and bringing them to the table to kind of expand the impact of those parents that are already engaged in different parts of a process. So maybe they're on a PTA, or they sit on a Head Start advisory board. So engaging those and helping and utilizing them to engage others that may not have had opportunities, or that are hard to reach, and garnering and bringing them into the table as well. And so that, when we talk about centering the family voice and the priority populations, I talked a lot about priority populations. So this is the list of Illinois' definition of who is included when we're talking about the priority population. So that's children of teen parents, children experiencing homelessness, children of families in poverty or deep poverty, children and families with child welfare involvement, children with disabilities, migrant or seasonal workers, families with low caregiver education attainment, families that face barriers based on culture, language, and religion, children of a parent or legal guardian with a disability, children and families with refugee or asylee status, children and families who face barriers due to immigration status, and children who are impacted by parental involvement in the criminal justice system. And so now I will turn it over to Jodi Scott.
Thank you, Sonja. To take a step back just a little bit, and we're very excited about the work that Birth to 5 Illinois is about to do locally, and the work that we're moving forward with in this region. But thinking about the commission work, personally having an opportunity to reimagine a system that would allow for comprehensive early childhood education experiences that leads with racial equity and prioritizes local community needs was a dream come true. So coming from an area that is made up of 9 community unit school districts, 5 licensed childcare centers, and is primarily rural, it's been difficult to navigate the braiding and blending of funds and services to best meet the needs of our local families. So our current structures, looking at home visiting, pre-K, and childcare, run through 3 state agencies and the Governor's Office of Early Childhood Development. In thinking about the funding sources that we currently navigate, the Child Care Assistance Program, Parents Too Soon, Healthy Families Illinois, Maternal Infant and Early Childhood Home Visiting, and the Early Childhood Block Grant, and all 3 grants under the Early Childhood Block Grant. In addition to that, the Parent Pay Program, USDA Adult and Child Care Food Program, the current ARP funding, Head Start, and early intervention, and additional grant funds. So with this many systems and mechanisms, our early childhood care and education systems overwhelming and fragmented. So it's overwhelming from a financial standpoint, as well as from a regulation standpoint, and most importantly, from an access and family standpoint. The complexity of today's funding system is depicted in the chart on the next slide. And this is what providers and families must navigate to get high quality and care and education for their children. So when looking at funding structures, providers and families navigate a system that includes competitive grants, ongoing paperwork, and unknown and delayed funding streams that is difficult for some families and providers to navigate. So many of our programs, including the Early Childhood Block Grant, are competitive grants. Competitive grants do not necessarily provide dollars to the programs and areas of the state that have the greatest need. We also look at the DCFS licensing program and CCAP, and the issues that we run into with CCAP, the delay in funding, the revolving paperwork, and the gap in services, and additional funds for Accelerate Silver or Gold. Through the Early Childhood Funding Commission, we discussed a new funding mechanism that's centralized and coordinated, where funding distribution is conducted in new ways with more stability and consistency for providers. And thinking about this system from a regulatory standpoint, similar to the financial standpoint, when you see all of these lines, we follow different regulations for each one of these departments and looking at the systems that we have to navigate locally. So we have DCFS monitoring annually, the fire marshal every 3 years, health department every 3 years with licensing, IDHS, CCAP annual parent paperwork and additional paperwork with ITERS and ECHRS monitoring, including Accelerate, whether you're licensed, you receive a bronze, a silver, or a gold. USDA food program monitoring, the Illinois State Board of Education implementation manual every 3 years, on-site monitoring visits using ECHRS and the compliance checklist. And whichever curriculum we use for our home visiting, we're monitored through parents as teachers. We have our annual APRs and every 3-year monitoring site visits with a compliance checklist from the state, as well as the constant checks with our curriculum and our social emotional curriculum. So looking at from a funding standpoint and from a regulatory standpoint, we're thinking about from a family or student success standpoint, how do we navigate these systems? So many agencies are doing good work. However, some overlap of services or gaps in services due to multiple guidelines exist. Separate programs funded through separate agencies do not always collaborate. Therefore, the system is not seamless for families, and parents must navigate multiple programs in early care and education. So it's difficult now to find centers with CCAP slots, and the CCAP paperwork has to be redetermined every 3 to 6 months. So it's a lot for families to keep track of. So after listening to Sonja talk about the family voice, I want to talk about a little bit of the work that we've done locally already and the work that we're looking forward to doing with the Birth to 5 Illinois program. We have created our early childhood system, we hired an early childhood systems coordinator in October of 2019. And we're working with our community and Illinois Action for Children in Partner Plan Act. And we've already developed our regional council, which we will be working with the Birth to 5 Illinois to either use our council or to develop another council and look at the work that we've already done and how we're going to move forward. So we have a core team in our region, and fortunately, we are looking at the same boundaries that Birth to 5 Illinois are looking at with our system currently, because we're covering the Regional Office of Education territory. And we have attendees on our commission right now, which would be our medical OSF St. Mary's, community representatives from Open Table Council, which I will talk a little bit about, early intervention. We have parents from our counties. We have prenatal to age 3 family educators, 3 to 5 family educators, child care center providers and directors, youth empowerment system of care, Jamison Center, our local libraries, and Loving Bottoms Diaper Bank, which are a few of our social service agencies that serve the same families. So what we've done to date is we provide a local needs assessment. Well, we did a system, I'm sorry, I need to back up just a second. We did a system scan to determine what we need to look at. And through our system scan, it was the lack of slots for childcare that really our families were struggling with. And so we did a local needs assessment, and we identified that 30% of the participants that filled out the survey searching for childcare never found appropriate childcare. 45% of the families searching for childcare took over 2 months to find adequate childcare. And the barriers that we identified, 57% said cost was a barrier, 72% said geography was a barrier, and 63% said their provider that they wanted was full. We have 44% said the hours of operation did not match the hours of operation in which they needed. And the reason I wanted to talk a little bit about the work we were doing locally, as Theresa and Cicely and Sonja talked about, as Birth to 5 Illinois comes in to coordinate this local work and focus the system on what our local needs are, it will very much help our state formulate programs that meet the need of our local people. Because what we have right now is a system that is, if you're looking at the chart right now, a system that is very confusing, that is trying to meet the needs of everyone with one statewide mechanism for each one of those systems. So one of the things that we identified as well, that I know we will be working closely with the Birth to 5 Illinois process, is our workforce crisis. We talked about this during the commission, and we talked about the changes that need to be made across the board. So we currently are facing a workforce crisis that we were already struggling with before the pandemic. So we need to create an equitable workforce structure for early childhood. The professionals need wages and benefits that can support their families without needing to use the family services. And we need to design qualification systems that puts more value on the professional development that occurs. One of the things that our agencies are dealing with, and our agencies across the state, all of our state agencies, our local agencies are doing great work. However, with the overlap in services or the gaps in services due to multiple guidelines, it makes it very difficult for our blending and braiding systems. So separate program funding through separate agencies do not always allow for collaboration. Therefore, the system is not seamless for families. Parents must navigate multiple programs in early care and education, and preschool wraparound services are very difficult. It's also in our area difficult to find centers with CCAP slots and the CCAP paperwork has to be redetermined every 3 to 6 months. It's a lot for our families to keep track of. And when we're talking about equity and diversity, the ability to navigate the current system is very difficult for many of our families. In our local area, some of the systems that we've been able to create at this point, we have put together, yes, Youth Empowerment Services System of Care. This is not just for early childhood, but it has helped our early childhood services locally. And this system is a program where you can bring family needs to the table and talk about all of the social service agencies that can provide those families with services. The reason I bring that up is because that's how I envision this process working through Birth to 5 Illinois, and the conversations that came out of the commission is how do we all sit down at the same table and determine the needs for our early childhood field and determine where we fit and what's best for folks and get all voices at the table. We also have Open Table, where it's a table of trained community members that come together to support individuals of families with complex needs in the areas of poverty, isolation, mental health, and chronic illness, who need social connectedness and access to a broader array of social capital supports to move to healthier and better lives. This is a similar concept to our Youth Empowerment Service Program, that all of the folks sit at the table and help provide those services that we wrap around a family. And it doesn't leave it to the family to navigate all of the separate services. We all come to that family. So our hope is, as we develop a system and work through this program based on the recommendations of the commission, that we develop a system where children thrive in an environment where the adults in their lives know and understand and can navigate their needs, and that we can meet children and families where they are. And I believe Trish will pick up from there.
Great. Thank you, Jodi. You actually gave me a great segue. So much of what Jodi has just shared is what really 10 years ago, why SPARK, which stands for Strong, Prepared, and Ready for Kindergarten, for the city of Aurora, it grew out of these concerns that Jodi has wonderfully articulated and shared in her part of the presentation. So as a local collaboration, our role really is about leveraging resources and supports for families and children. It's about helping families to navigate through, as you saw, a very complicated system and make that path easier. But it's also about connecting our families, especially those who are furthest from opportunity, know about the program, know about not just early childhood, but all the systems in place in the community that can really support healthy outcomes for families and young children. It's also about building local capacity. It's looking at our data to increase opportunities for enrollment for young children in our community. And it's about coordination of services. Much what Jodi has shared, locally, we really are working towards a shared vision that we make this landscape for early childhood less complicated and work more effectively in our community. And these premises of how we work as a collaboration really align to what Sonja herself shared. It's aligning values to the Birth to 5 regional infrastructure. It's aligning goals, it's aligning strategies, it's aligning messaging with the Birth to 5. So as the Birth to 5 regional infrastructure start to stand up, it's working in partnership with the regional entities. In our case, it's for Kane County, which is Region 31, and really looking for the opportunity of how local collaborations in our area can work in partnership to support families and children, coming together, looking at data and looking at ways that we can strategize as a region, but then localize those strategies in response to the culture of each community.
And again, and centering family and family voice and equity in all the work that we do. So that's, I'm very brief because my colleagues have shared a lot already about what they've done, and I'm sure if there's any questions, I'm happy to answer that in the panel when that time comes up. So Cicely, are we transitioning through?
We are. Thank you, Trish, and everyone else who shared. So we do have the chat open. Jim, if there's more directions in terms of questions, I can only see the chat on my screen, but the chat is open for questions. And I realized there was a point that I also skipped, so I can go back to my own presentation. But the only question I see right now is from, let's see, Allison, who had a question about how will communities be empowered to address service gaps these councils may identify? Will be grant or other new funding available to expand, build, et cetera? So Allison, our goal is that the findings of these councils, as Sonja and everyone else mentioned, that are influenced by what parents are saying and students are experiencing, will then help to direct what the state is doing. So as was mentioned from the Funding Commission, that was the goal that was set out. We do not have any legislative power or authority or funding authority as the council, but we do hope by collecting all these voices and narratives and really making the strong case along with the technical training that the councils will get from Action for Children, that will make a strong case to our elected officials to say why we need to, that kind of chart that that Jodi showed and all the kind of crazy ways in which we fund it, why we need to make it more streamlined, right? So it works better for the parents so they can get their kids in an activity or in a program without Trish and her team having to do all the legwork and explanation for them. So that is our goal. Also, by bringing all the elected officials and folks together locally, we hope that they will then have a better understanding of how they can use their own local dollars to expand services, right? And so if there's local spend or federal dollars that they have an opportunity to use, that they will be thinking about how to expand early learning, whether that means, you know, the building that you mentioned or the teacher shortage that Jodi mentioned, that the communities will have the information they need to make decisions when funding does become available. So that's definitely something that we hope to be able to move the needle on, but we don't want to make any promises we can't keep at this point, but we are going to work very hard to make sure that we have this advocacy arm and we make a clear story. That is something the councils will be doing with Action for Children. They lead this work, as Jodi already mentioned. And so Jodi's fortunate to be working with them now on Partner Plan Act, and many other communities have, but the majority of our state has not. And so folks that Trish represents are fortunate to have her agency, and Gail is doing another job. I'm sorry, not Gail, excuse me. Jodi's doing another job in terms of her superintendent role of kind of creating this council that she already mentioned, but so much of our state doesn't have that. That's why it's important we launch this statewide infrastructure. And as Jodi said, we'll partner with her, and I think there's about 5 other regional kind of locales that have a council going, and we will support them best we can. We will bring in all the infrastructure support and training and technical support we can, and our state office data support to make sure that they have what they need to really understand what's happening in their region. And then communities like Trish, where they have a local collab, will partner with them and just build upon what they've already done. But again, so much of our state doesn't have that. So we need to make sure every child and every family has that advocacy arm that they don't have right now. So we hope to do that through our work. See, am I manning the questions over here? All right, are there any more questions? All right, so I will tell you, and if they come up, I'll try to catch them, kind of what's next for us. And so, as I said last month, we did a pretty aggressive kickoff around the state. And so we're going this month into community to do kind of more targeted conversations. At the same time, on our website, we are starting to hire those regional managers. So there are 38 plus Chicago that will be going up pretty soon, where people can apply for those roles. Once we get those regional managers, then they will start the work of hiring their family and community engagement staff. And then there'll also be like a data admin staff in each region. So that's the infrastructure we provide. As Jodi said, she already has some of that staffing. So in those kind of communities, we'll try to leverage what we can. So if there's a way that Jodi can, you know, release her staffing or use funding for something else that we don't have funding for, we can provide the support for that staff, and so that she can kind of leverage all those limited dollars that she has in the way that works best for her community. We know that there's rural communities that might not want so many managers, but maybe need actual boots on the ground in terms of family community engagement. So we can try to work with communities best we can from the direction that we've been given from the state. to make sure that they can be represented and their families are brought to the table. As Sonja mentioned, we know families might not want to join a council. There might be a lot of reasons for that. We respect family choice. And so we still will be going out to hear from families, whether it's focus groups or surveys or however we can do that, because we don't want anything produced from the region that really hasn't been vetted and approved, so to speak, by families, right? We don't want to just look at data points, because knowing that we have 20 preschool slots available doesn't really tell us why they're available. So that's why we need families and providers to let us know that. What our state team will be doing is just providing all of the infrastructure support that people need. And then at the end of the year, kind of collecting these regional scans that each region will work with Action for Children to produce, so that again, we can make sure the narrative matches the data. And so our state can get a better understanding of what's happening and how they can ideally leverage those dollars and all the work that Theresa is doing around governance to make sure we do have a system that works for every child and is not complicated for every family to navigate, because then we just kind of lose families and children early on. There's also a way for you to fill out an entrance form if you want to be on a council, a family council, or an action council. And so that's also on our website. We're just gathering those, really not an application, but for us to kind of understand who's interested, where there's interest, so we can make sure we're doing aggressive kind of outreach where we need to, in places where councils might be ready to go because there's a lot of interest. We can go ahead and start lifting those councils up. We have the framework here on the website that Maggie's going through. Thank you, Maggie. And the council, these interest forms also just give us an idea of like what the perspectives are, what the diversity is, because as Sonja mentioned, we want to make sure we have a variety of perspectives on these different councils. And so that just kind of gives us a chance to see how many business leaders, how many parents, do we need to look for more providers, and all that kind of information, since we're not physically in the communities. And then we do have our area coordinators who are going to be working and following up, who are kind of closer to community than we are right now. So once we get these, our goal is really simple. We want all of this to be driven by community. And so we can work with community to put these councils together. We do have kind of a matrix that will be getting online pretty soon. If folks are interested in supporting this work, but are like, I don't want to be on a council, I have too much on my plate, they can be on what we're calling kind of our selection committee, so they can help us build these councils in their community. It's kind of a short-term, one-time job, because we realize we're here in Chicago in the state office, we don't know your community like you do, right? So we want to make sure this community represents you. And so therefore we want people in the community to really help us put that together. And then once these councils are up and going and we have a staff, they will get about the business of kind of understanding their community, doing some training with Action for Children. And as Sonja said, we're going to let them dictate how and when they meet. We are just going to kind of be in the background to make sure all that comes together in a way that we can present an accurate description of your early learning community to the state and help you advocate for any change and help you be ready to capture any dollars or anything that comes into your community. Theresa, do you want to speak a little bit more about the workforce piece that you're working on, since it was brought up?
So we are, as a state, also really investing in workforce development for early childhood. We recognize that this is the key thing that is holding us back in many communities, of being able to even have the number of services that we already have funding to provide. We've got a lot of closed classrooms out there, whether they're in childcare centers or in school-based preschools all across the state, for a lack of qualified staff to run those programs. So we are investing as a state $200 million of our federal relief funding to the Early Childhood Access Consortium for Equity, which is doing a couple of really important things. One, really smoothing the pathway for people who are going into the early care and education field. We've long talked about the problems of articulation from the associate's degree into the bachelor's degree. We're really trying to make a seamless pathway across all of our community colleges and state universities and several of our private universities who are big in the early childhood space, making sure that we have that kind of seamless pathway for people to get the credentials that they need to be able to teach. And then combining that, not just with scholarships, which we'll have very generous scholarships, so you can go to college for free if you're going to be in early childhood education, but also with navigators and supports for people, both navigators in our child care resource and referral agencies all across the state, as well as navigators at the state institutions, so recognizing that this is a really hard thing to, while you're working in early care and education, to be going to school nights and weekends and all of that to get the qualifications you need. So we're going to be really providing that kind of support for people to get those credentials. I encourage folks to look into what's happening there. Those scholarships are already available.
Thank you. Any more questions? I think all the links for our website have been, oh, Deborah has one. I applied for the council. So Deborah, we are working as fast as we can. We are starting to sort those applications. We wanted to make sure we made one more kind of round into community. So that's what we're going to start doing next week. We'll be meeting 2 evenings a week over the next 6 weeks to make sure we get into community. So we're going to do that at the same time as starting to look at those interest forms. So if you just can be patient with us, I think in the next couple of weeks, you'll hear from us. When we go into community, we want to make sure we make these offers to everyone, understanding that everyone might not even know, what we're talking about right now. So we want to do our best to include everyone we can. So just be patient with us, and we definitely will get to. We appreciate your interest in that. And that's the same for if anyone has applied for one of the positions. We're going to start having INCRA, who is our fiscal agent. We are a department of INCRA, to go ahead and start screening folks for those. We want to make sure we offer those positions to everyone we can around the state, so we have a diverse voice there as well. And I think the last thing I was going to get to is just to reiterate in terms of our infrastructure support. I know Trish has a very active local collab, and as I said, everyone doesn't have one. So we do have, albeit limited, we do have some funding to support local collaboration, because we recognize they're going to need to still exist. Even though we're standing up this regional structure, we are not going to be doing the work that they're doing in community with the parents, connect them to service. And so we need to make sure those local collabs are sustainable. And so we're going to do the part we can to support the local collabs that are already going. And we also have some funding that will help communities that don't have a local collaboration to start just kind of thinking through how they even build one, what the capacity looks like, what the role of local collab is. And so those fundings will be coming out, that funding stream and information will be coming out very soon. We just onboarded a staff a couple of weeks ago. So we're working as fast as we can to get that open as well. So that we can, again, we're going to have what people might think is duplication of services, but we recognize the local collabs are really working with the families, whereas we're working on a little bit of a higher plane with the other community members who are not necessarily, receiving the services in terms of our business leaders and such like that. So all those things are in the works. We're working as fast as we can. Open for
Hurry, there's a fight, hurry.
We're open for questions and suggestions. And some of you all might have heard Theresa and Cicely earlier on or last year giving presentations, and some things have changed because we've tried to respond to community as best we can. And I think that will continue to be what we do. And so bear with us there. If you see some things that are changing, if you have a question, we're always available to answer that. But as we get into community and hear what the concerns are, we will try to kind of navigate we best we can. And we realize each council and each region is not the same. And so we will launch the councils based on what works for the regions and support them so that everyone has equal access to the state supports we have. Let's see, there was another question there. Theresa, people interested in ECE training positions learn more about financial and other supports available.
I think Maggie did post in the chat where you can reach the website for the Early Childhood Access Consortium for Equity and find out more information about those grants. Now, there was another question in there about compensation and how we're trying to take that on. Obviously, that's a huge issue in our field as well. It's really what undergirds the lack of staff that we have in the system, is that we're not being able to pay them enough across the board. In some respects, the long-term answer to this really is we do need the federal package of supports for early childhood to pass. That will be the answer to this work long-term. But as a state, we're really taking some steps towards making a difference in compensation for early childhood, particularly in the childcare space. So the Strengthen and Grow childcare grants that were announced last fall and that opened up in January are really the state's effort to use some of this relief money that we have to address specifically the issues of staff compensation and benefits. And that is grants that are at the level of about $25,000 per classroom, $10,000 per family childcare home. at least half of which have to go to increasing salaries for the actual staff in the classrooms across the state. So we are taking that very seriously and making sure that's a centerpiece of all of the work that we're doing in terms of providing pandemic relief.
And then also, I just kind of wanted to jump in and add that we have funding as well. We will be putting out an RFP of sorts, not really calling it an RFP, but more of an application for the funding that we have to support local collaborations that are already existing. We have some money for implementation to help support finding children and connecting children and reconnecting children back to services in early childhood. And we also have some money for planning for those areas in the state that do not have local collaborations working or advocacy groups working on their behalf. There is an opportunity to get funded to start a collaboration. So those are coming in the next couple of months. You should next month, hopefully, you should start to see some more information about that. Applications will be coming out soon for that. So just wanted to put that out there too, that there is additional funding that we have to support local collaborations and the startup of collabs and advocacy groups where there are none existing.
And I think the last thing I'll add in there is that we are working with Every Child Ready Chicago. If you're familiar with that, they have been doing this, I don't want to give it time because I'll get it wrong, I'm sure, but they have been convening a similar council. And so we are going to be supporting their efforts, and they will be the Chicago Regional Council. And so we have been working with them. We just finalized the date, April 6th, when we'll have a kickoff, so to speak, for Chicago. More of a reintroduction of the kind of merging of Every Child Ready Chicago and the Birth to 5 Action Councils. And so more information will come out about that. If you've signed up for our newsletter, you'll see it there, but also Every Child Ready Chicago will be sending information out as well. And so we will be joining forces with them to make sure the students in Chicago are also represented. It will be just a little bit different because, as I said, they've already been going just similar to Jodi. And so we'll be merging our efforts to make sure the state infrastructure and resources support their work as well. The existing collabs and forum regional work. And so existing collabs, as I mentioned, are really doing the work now to connect parents and families to services. And so they know a lot about their community. We look to build on that. We will not be doing the connecting families from the regional voice, but we want to understand the regions as local collabs understand them. So there is a space for local collabs, obviously, on our councils, but we look to partner with them outside of the funding that Sonja mentioned. We look to understand the community based on how they understand it. We will look to partner with them in the engagement efforts. And so where Trish's collab might not have enough capacity to do some engagement, since we have engagement staff, we'll be working with her to make sure we're engaging communities that maybe she hasn't quite had a chance to tap into or who are hard to engage. We'll make sure we put resources there. And then obviously they'll just be a partner as we continue to advocate. They're already doing that, so we'll build upon their advocacy. There might be a bit of duplication, as some collabs have already done some work with Action or on their own to really kind of do a little more of a scan. But we're looking at the regional scan, so we want to make sure what they already know is added into our regional scan work so that every community in the region is represented. All right, seeing no more questions, I think we'll be able to end 2 minutes early. I thank you all for joining us. Thank you for the speakers that we have had. If you want to look in the chat, all of our email addresses, I believe, are there, and lots of links. We look forward to working with you in the community. If there's something that you want to make sure we know about that we don't, or some folks you think we need to connect to, please email us and we will have our staff reach out to them to make sure that they are aware of what's happening. And we look forward to launching and doing this work with you.